trained on the capital city.
Good evening, everyone. We're coming up on the Cobb TV streams this evening for our town hall with folks with Cobb and Douglas Public Health. We have in attendance with us today County Manager Dr. Jackie McMorris, Cobb County Chairwoman Lisa Cupid, Dr. Janet Memark with the Cobb and Douglas Public Health, along with Lisa Crossman as well. And to start things off this evening, and by the way, we've already got a ton of questions, more than 200 emails in, a whole long list of questions. Feel free to comment on the social media streams if you have any other comments or questions as we go along tonight. Dr. Jackie McMorris, please start us off.
Thank you, Ross. Good evening, everybody, and thank you for joining us tonight. We realize that you could be doing many things, but you have chosen to spend a little time with us tonight, so we just want to say thank you. Thank you to Ross and his staff and the IS team, as well as to Cobb Douglas Public Health and Chairwoman Cupid. As you can imagine, there's been a lot of information out there as we transition from testing or screening and beginning the vaccination process, which we started about a week ago. There's so much information out there. There's a lot of frustration included in that information. It's ever changing. So tonight we want to take a little time and address some of the things that are frustrating to you and frustrating to us as well. And we are grateful that Dr. Memark and her team is here and Chairwoman Cupid is here so that we can try to put some things into perspective and address some of the many questions that you all have already asked us tonight. So I welcome you on behalf of the entire Board of Commissioners and in partnership with Cobb Douglas Public Health. We hope that by the end of this evening, we will have answered most, if not all, of your questions. So sit back, relax, and enjoy the program. And we wish you well. You are staying safe. Thank you.
Yes, good evening, everyone. Reiterating the same points, we appreciate all of you for taking time to be here today. We recognize that this has been a frustrating experience for a lot of you as you've tried to not only wade through a pandemic, but also wade through the challenges that many of you have experienced in scheduling vaccinations. We share some of those same frustrations, and in talking amongst ourselves about what we can do to best relay our observations to the public, we thought a town hall would be one of the best ways to communicate with you, so you can hear directly from our leadership here with Cobb Douglas Public Health about where they are and how they're doing their best to meet you where you are. As was stated, we've received a number of questions, and we are hoping that we can answer as many of them as possible tonight through this forum. And we ask that you help us in spreading the word with those who may not understand why they are experiencing the difficulties they've had, but also share with them the opportunities that you may learn about for how you may be able to sign up for testing, if not through Cobb Douglas Public Health, through another medium that could be provided. So again, thank you. We appreciate you being here to discuss a very serious matter within our community. And I'm grateful to our leadership here at the county for being present to help respond and address your concerns tonight. Thank you. With that, I'm going to turn things over to Dr. Memark with Cobb Douglas Public Health.
Okay, good evening, everybody. Thank you for having me tonight. I'm going to just go over just some quick highlights of what we're seeing in the county, and then we'll jump into some just general information I can give at first before we launch into questions about vaccination. So for right now, we know that we're just under 25 million cases in the United States for COVID-19. With we've crossed that 400,000 death mark, and so I was just telling my colleagues here that you know, this is more deaths than we had in World War I, Vietnam, and in the Korean War combined, and just hovering around the number of deaths that we've lost in World War II for U.S. soldiers. So it is a staggering number of deaths that we're seeing right now. In our own county, we have 621 deaths, and the pace that January is heading on is giving us really some just moments to pause, because we are seeing a lot of deaths that are coming in from people who are losing their battle against COVID-19. We also have 46,363 cases in the county, and we've discussed this before, that when you include the antigens and PCRs together, we're over 1,000 cases per 100,000 folks in the last 2 weeks from COVID-19. Our hospital situations are quite critical as well. With we have the largest number of folks in a hospital from across the state, and that is in our county, and with very low critical care and medical surgical beds throughout the county. And so this is, we had a discussion this morning with our WellStar partners as well. This is a concern because, it's not just COVID-19, but if you have problems with other issues, medical conditions, including trauma and time-sensitive conditions, that puts you more at risk as well if you have to seek care. So we definitely have a critical situation, and and Cobb and Douglas continues to work on all of those things as well as we work on this pandemic. So we'll switch to vaccines a little bit, and I wanted to apologize first off. I know that it's been very frustrating to try to get appointments through our website. This is something that we had to put together last minute. There was a state system that we're expecting, and it has been delayed, and so we had to put together a scheduling system to put it out broadly, and obviously we run into some trouble. And so this week we're actually talking to other providers to move it to another server altogether, and off of the state servers, to see if that will help. And we've had some partners that have had better success with that, and so we're looking into that solution for the scheduling. Ultimately, I know it's very frustrating, but ultimately the main issue is that there's really not enough vaccine for the demand that we are having right now. The demand is just tremendous, and there are, several million people that fall into this category now of being eligible for the vaccine. And if you look at the DPH dashboards, there's less than 1 million vaccines that have been allocated. And we are, up to this point, we've only had 80,000 a week for the entire state to be allocated. And so when you do the numbers, the comparisons are quite low. And we have people just driving all over the state to be able to get vaccines anywhere they can potentially get it. And so it's definitely, this will be a little bit of an issue. And we hope that the federal government will be able to send us more vaccine, and I think tomorrow we'll know a little bit better with the change of administration if we have some vaccines that will be coming down to us a little bit at a quicker pace. But the state continues to work on different ways to try to get vaccines out, and I know they're working on some mass vaccination opportunities throughout the state. Cobb and Douglas, we hope that we can get out about 1,200 in Cobb, and then eventually we're standing up a Douglas site right now that hopefully they can do 1,000 a day too. But that's really, it's 2,000 a day compared to how many folks we have that need the vaccine. And so, and this is just the first category, and we haven't even moved on to 1B. And so the demand is quite high, and so we have multiple partners. I'm hearing about the Krogers and Publix. WellStar started their own vaccinations today with their patients, and so that's going to be a huge help. So all of us working together is really the only way that we're going to be able to really make a dent and get as many people vaccinated as possible. And so we continue to work with a lot of our partners to try to get people vaccinated as quickly as we can as supply is available. So do you want to go into your?
No, I was just going to say, for folks who are trying to get an appointment, one of the first things I would do would be to check with your medical provider, like Kaiser or WellStar or Children's, probably not Children's because they're not eligible yet, but your own medical provider may have vaccine and may be able to provide that. The second place I'd check is your own home pharmacy. Because a lot of the pharmacists are also coming on board. There are about 1,700 approved providers across the state, and all of them are working to get vaccine in and to help provide vaccination. So don't feel like you have to come through Cobb and Douglas Public Health for that vaccine. You're muted, Dr. Memark.
Did you mention the state website too, the vaccine locator, which I did see change. So I saw the providers switch out. And so there's 2 new providers on there. So you can just keep watching that regularly. And they're really trying to pick out providers that can be able to service the public with vaccines. And so I know they're trying to be strategic about that.
Another point that you might check is with your own employer. If you are 65 and older, but you're also still employed, you might check, because some groups are considered closed pods, like KSU or Cobb County government, and they're trying to help us vaccinate the community by vaccinating their own employees. And so you might check with your employer. They may be able to provide you a vaccine as well.
Okay, did you want to start the questions, Ross, or do you want me to go into more just general stuff, or?
Yeah, I think Chairwoman Cupid may have some of the more pressing issues that we've been dealing with. Chairwoman, you want to start off?
Thank you, Ross. Dr. Memark, we've been fielding a lot of correspondence from constituents. If you can help to provide them a little bit of data on the disparity of where our population is and the amount of vaccines we're receiving.
Mm-hmm. So up to this point, if I do the math quickly, we look like we have about 7,700 vaccines that have been done, 7,700. That's just at our locations. That does include Douglas as well, but they just recently started, so it's not much at all that they've done. And we've shared over 1,000 vaccines with our providers. We've used our own inventory to be able to vaccinate some of our highest risk folks. So people in nursing homes, as well as 65 and older educators and healthcare providers. So we've had several providers that be able to help us with that. Just this week, we've been asked to provide the number, how many vaccines that we are able to do. And so we give them the number we usually do around 700 at the Jim Miller location. And then we're shooting for about 200-300 at Douglas. Remember, we can go between Cobb and Douglas if you need to get an appointment. It's not too far to be able to do that as well. And so right now that is what it's looking like our kind of capacity. And then Douglas, we are signing with the provider to be able to do a large site there as well. And so you can go in between the 2 sites. And so right now we're shooting for about 1,000 a day per location, but right now we're at about 700 and 200 is what we're looking at right now.
Very good. Ross, do you have any questions that you want to provide that we've received directly from constituents before
Just a few.
Just a few.
The first one we get a lot of is, I've gotten the first dose. How can I be assured I will get the second dose? And how can I be sure I can get an appointment to get the second dose?
Good.
So that's a great question, Ross. So let me begin with one thing. Seems to be a lot of anxiety around the second dose. And so the recommendations from the ACIP and CDC is that we try to get as close as possible to getting that second dose. The state of Georgia has asked us not to go before the recommended date. So that's 21 days for Pfizer and 28 days for Moderna. But there is no time limit to get the second dose. So please don't panic if you do not get that second dose right on that day, the 28th day or the 21st day. You still have time. You do not have to restart the series if that should happen. And so I want everybody to first just, be okay with that. Okay, we may not get the exact day, but our staff for our vaccines will be reaching out to the people that got the doses with us, and we will be scheduling with you to get the second dose with us. And so we are putting them through Jim Miller because it's the safest and quickest location to do that. And so you will either get an email or a phone call from our staff to do that. And so remember, we have to have the people that got vaccinated with us and it has to be Moderna. So we cannot take everybody else's second dose, allocations, because we have really scheduled it out to be able to accommodate that second dose with us. And so you should receive correspondence. If you don't, then please let us know and we will get you in to get that second dose. But they have a running list of everybody and they will contact them. When our scheduling site, the second one goes live, we're going to do a better job of making sure that we kind of get you those appointments ahead of time. But we had to build the capacity and do a lot. Remember, as we were building this plane as we were flying in, so we have to make sure we increase. It was not easy to go quickly to 1,000 capacity, and so they are doing a great job, our staff, about building it as we go and getting a lot more crew out there. So.
And Dr. Reinforce that folks don't have to come to us for their second dose, even if they got their first dose with us. They can go to any provider. They just have to make sure they get the brand of the first dose. So if they got Moderna first, they have to get Moderna for their second dose. And same thing if they got Pfizer first. So just ask the provider if you find another location that you might be able to, that you wanted to go to, then just ask that provider which vaccine that they're providing.
We have a lot of people who are not clear, I should say, on 1A and 1B and who's eligible now and what that all means.
Yeah, so that has been a little bit confusing. So we have our healthcare personnel, and so if you belong to a large facility like the WellStars, they have their own list of folks that they are vaccinating, and so they receive vaccine to vaccinate their healthcare providers, and it includes infrastructure to keep the hospital going, right? So it'll be your environmental services people, food service, those kind of things. We have been take the 1A as well, and so we've gotten a list of over 3,000 folks that we've either been able to service ourselves, or we have our partners that help us, and we send them the list so we can try to prioritize them as best as we can, so that we get healthcare providers done who have maybe have missed that first window with us. So we have an ongoing relationship, which I'm very grateful for, because that helps us to continue to try to vaccinate 1A providers, healthcare providers. Included with that is our long-term care residents and staff. And so you might have heard, this is outside, this is more of a federal response and not a response by us on the local level. So the CVS and Walgreens are helping us with vaccinating these long-term care facilities. They're doing the majority of the big ones. We have had some smaller ones contact us that they're not eligible or not on the list or missed the window. And so we have another partner, we're grateful for them, that are helping us to vaccinate those people as well. And so we have some really, really great strategic partnerships that are helping us to do this. What we like to call 1A plus is what the governor added on January 11th, and that's our 65 and over residents throughout the state. And this is probably one of the largest groups that we're going to encounter. So they were added on with, you can bring a caregiver that has to register as well. And we're asking to limit one per senior, only because we cannot measure our supply really well if too many people bring too many extra people. And so, and a caregiver, there is a CDC definition for a caregiver. And so we can definitely look that up on the CDC, and I have some information just to let people know. It's providers that provide care to people who need some degree of ongoing assistance with everyday tasks or on a regular daily basis. So they have to they can live with you. You can be in a residential or institutional setting, and have chronic illnesses and disabilities as well. And so we just wanted that's the group that we have at this point, and it's a very, very large group that we are trying to get through.
All right, next question. My neighbor is not very tech savvy, doesn't have access to the internet. How can they make an appointment?
Yeah, so we're looking at options for that, and so definitely that is kind of a difficult issue to get through as we have so many folks that are in need right now. So we're working with our partners on that as well, especially working with the county and senior services to help us out with that. Douglas County as well, they're doing the same thing, and we're working on having a call center and things like that that will help with some of the volumes of calls. And so, but we're working on ways that we can get to this population of folks, and so. So stay tuned, but we continue. If you reach out to us, we should be able to have someone reach out and do an assessment to make sure that that we can try to help whatever needs, because there are going to be some issues, whether you can get transportation or not. You don't have to have insurance at all, and so we can definitely take care of you, but definitely the way we have it set up is through drive-throughs. And another way is that we're setting up outreach teams right now too. And so if you can't come to us, hopefully we can come to you at your church or at another setting where we can bring the vaccination and team to you. And so that team is being built right now to be able to go out and help us, because we realize that people cannot always drive through at Jim Miller.
And Ross, I would just add, just like when my parents were alive, they weren't very tech savvy either. And so when I had to help them make, medical appointments, I would help them do that online with them. And so we would encourage family members and friends to help these seniors make the appointments that they can, and then help them by helping them transport, like driving them over to Jim Miller Park for those appointments, just like you might take a senior, close senior to you, to their physician appointment.
And I think you already touched on this, but we're getting a lot of questions about the website and when and how that should work, and when the appointments will be opened up. So can you tell folks about when they should jump in to try to get the appointments for the following week? And how far out you're making those appointments?
So we make the appointments 1 week out based on vaccine supply. And so we have yet to hear what our vaccine supply is for next week. And so we wait. The last thing I want to do is make appointments that have to be canceled. So we make available what we have for staffing as well as vaccine. So that's first thing. So a week at a time. We started with Friday at first because we were having server issues and phone issues. And so believe it or not, COVID is not the only thing that the health department does. And so we had to be able to function and be able to do all of our other duties as well. And so we made it on Friday for now, but it looks like the new software that we have may be more promising. So hopefully next week we'll be able to open more appointments more sporadically. And so, but it'll be taken to another server and another site that will do the appointments for us. And so I think we'll be able to do it a little bit more sporadically, but the main basis is that we start with what we have, the supply that we have. And so there will be a big tranche of appointments that will go out first. And then if we find that, we have more staffing or more vaccine or something, we can add on as we go along. And but we need that software, and it looks very nice, and it looks like it will help us a lot probably next week.
And Ross, just to remind residents that, even though we wait until Friday at 5 to release that next week's appointment, as Dr. Memark said, we do that so that we've reduced the other demand on our servers and on our website. The other is that our staff are still here and still making sure that all of that goes smoothly, and to be able to troubleshoot it and give it our undivided attention. So it's not like folks are leaving at 5 and letting the website handle its own thing. We've got staff here that are trying to make sure it goes smoothly.
With that, Dr. Memark and Lisa, can the public still sign up to be tested through Cobb Douglas Public Health?
Yeah, thanks for asking that, Madam Chair, because we still have our testing that's on there as well, and it's at different locations, and so it does move around a little bit. You can go any of our Cobb and Douglas locations, and we are in talks to have another site built for that by a third party. But I do want to urge caution when you do that. Please double check what you're signing up for. The testing site, it will give you an appointment, but we've had multiple people show up and say that they got an appointment for vaccination, and they went to a testing site, and they do not have any vaccines on hand or any capability to vaccinate folks. So please double check that. that you have the right appointment.
And Chairwoman, some people have wondered if we converted everything over to vaccine, right? We've still got a high demand for testing in the county with the high case rates. And so we were providing about 10,000 tests a week. We've been able to very seamlessly convert over and expand our other staffs. And so we're still providing about 8,500 tests a week, test appointments a week at various locations around the county through our core partnership and the Air National Guard folks. And so they shouldn't have trouble getting a test. They're still free, and we're still seeing the results turn around in about 24 hours to 36 hours.
You're muted, Chairman.
Thank you, appreciate it. If a resident is trying to schedule an appointment for vaccination and they continue to get an error message or just have difficulty getting through, what should they do? Should they just continue to keep trying every day? Should they wait until a particular time? What options are available?
We're waiting till Friday to have the new software put out. So hopefully that will help. But remember, the appointments are going to go quickly. And so we just don't have enough vaccine to be able to do everybody. So this is going to be in small steps. But keep watching the vaccine locator for DPH and see who else has vaccines. So we know the WellStars, and even we got an email today that Kaiser was doing it. We know Piedmont is doing it. We know that Kroger and Publix, there are a lot of vaccinators, a lot of pharmacies as well. And so they're definitely, it's not just us. There are a lot of people that can do it. You can keep checking us, but remember, we don't have that many vaccines to be able to do. So we'll have to keep relying on partners to help us.
Yes, I heard a pretty glaring statistic about one county having 9,000 positions or scheduling slots being taken up in about 6 minutes. Yes, I just want to give the public, a realistic picture of how difficult we recognize it can be for scheduling, that these slots go very quickly.
Yeah. We need the federal government to be able to increase the supply and get it out there. Lisa had mentioned there are over 1,700 providers throughout the state. They're all waiting. And we get contacted all the time about providers needing vaccine. They're all approved, but they don't have any vaccine. Even our own health departments, district health departments, they are not getting enough vaccine. And so that is one of the major bottlenecks. It's just not coming from the federal government. And so we're doing the best we can with what we have, but it's just not enough coming. And I tell you, if we looked at the maps, we only have maybe 4 providers at a time, 4 to 6 providers here in the county, for 1,700 that have applied. We are what one of the largest districts in the state that make up almost 10% of the state. It tells you how little we are getting and how few providers. So we have to have some patience to have it come down. I think one of the beautiful things that we're going to see is when enough comes that it'll go and you can go to your Kroger and go to your doctors and go to anywhere pretty much to get this vaccine. But the reason why you're not seeing it is it's just not enough right now.
In light of that, and I don't want to come across as a public health expert or official by any means, but it's still important that we are mindful of what we can do to slow the spread under these circumstances. Dr. Memark, if you can talk about that.
Yes, so thank you for mentioning that, because we've talked about, we're at over 1,100 cases per 100,000. I don't know about you all, but I have lots of friends that I know that are getting ill and people that have been hospitalized. And so the cases are very, very high right now. And the only things that we have are the things that we've been doing. And I know people are very, very tired. Even my own health department employees are starting to slack a little bit because they've just been exhausted by this and it taking a year. But we need to make sure we have to socially distance. We got to wear our masks and wash our hands, but we cannot gather with folks outside of our own families right now. It's really too many parties and even athletics. I mean, the outbreaks that we're having, so many of them can be pinned to having athletic outbreaks and teams. And, and now we've received word that we do have cases of the COVID variant in our county. And so these are much more contagious. And yeah, they may not be more deadly, but they can make you sick enough that you get hospitalized. And so if this takes over our county, like LA County, we're going to be in just really the most dire of situations. So we have to clamp down and be able to do what we can until more vaccine comes out. And we're all waiting for more and more of that to come out.
And Dr. Memark, just to add, Chairwoman, that we have, a lot of times people are thinking that the minute they get the vaccine, that they are immediately protected. And so one point that everybody needs to remember is that it takes your body a while to build up immunity, right? So the first is that this is a 2-dose series. And if you're talking about the Moderna, that's 4 weeks apart, it potentially could take you 6 weeks from the date of your first dose to where you really have developed your immunity. So in that entire time, we absolutely need folks to continue to follow the 3 W's because they are still susceptible. The second is that, because this was an emergency use authorization and a new virus, we don't have a long-term experience for how long this vaccine will provide protection. We know that it's several months for right now, but we don't know if this is going to be a vaccine that has to be repeated yearly or whether it might be a one-time series. And so until we know all of that, and until we get to a herd immunity level, folks still need to continue to follow the 3 W's and not think that they're just free and clear after they get that first shot.
And Lisa, what is the herd immunity level?
Well, they're still trying to figure that out, the herd immunity. And so we do need to have a high percentage of our folks to be vaccinated. So the numbers kind of vary. You see anywhere in the 70s to 90s for that. So.
Oh, wow. Speaking of statistics, and Roz, I'm going to turn things back over to you. I know you still have a lot of questions, but if you can talk about that case rate, 1,100 per 100,000, what does that mean?
So it's a great question. So we look at that in the 2-week periods, in 2 weeks previous to when the number is calculated. And so remember back when it feels so long ago that 100 per 100,000. So that's a rate at which your citizens are getting infected. So out of 100,000 folks, 100 would be infected. And so when you multiply, let's just round ourselves to 1 million. So for 100, so you would multiply that for times what, 10, right? So that'd be 1,000 folks in 1 million that in 2 weeks would get infected. And so I'm just doing some quick rounding. And so when you're looking at, so now we're looking at another 0 added on. So 1,000 folks per 100,000. And so if you had 1 million folks, so what did we have that? We had 1,000 and now you're adding another 0, right? So 10,000. So it's a number of people that we've had infected in the last 2 weeks at the rate that people are getting infected. And so for those of you, I was going to say kind of junkies that watch this kind of stuff, I can definitely feel it when we were at 100. And I don't know if you all remember that when we touched below 100 for about 12 hours, but the rates were just much lower. You didn't see as many people. Now with the rates as high as it is, I have people in my own health department, my friends. I mean, I just hear about it all the time. People say the sphere has just really decreased. It gets closer to you, that higher that number is. And so it's definitely a very high concern. We are at extremely high numbers that I do recommend that we do our best to almost shelter in place the best you possibly can. And I know that people can have to go to work and some have to go to school, and you got to do all these things. And I totally understand that. But if you have the possibility of being able to work from home and learn from home and play from home and pray from home, it's really important to do that, because this is a hotbed of activity right now.
All right, we are getting a lot of questions that are coming in from the website and from our social media channels. First of all, there's a thread going on about people concerned that some of the vaccines going to waste. So they're asking, why can't we set up a wait list for people who cancel or don't show up, and then we can jump in and do that. And then there's also people saying that there have been reports that the states received this much vaccine, but we've only used this much vaccine. So I guess along those lines, what about a wait list, and is anything going to waste?
You're muted.
So we do have an emergency list that we call it. So our crew tries very hard. For Pfizer, there's at least 5 doses per vial of vaccine, and sometimes they eke out 6 or 7 doses out of there. For Moderna, we get 10, and when I've been vaccinating, it gets really close. It's pretty much 10 that you get. And so at the end of the day, they do a really nice job of trying to, kind of squeeze down the lanes and bring it down to the last bottles. And so at the end, you can have anywhere from 1 to 9 doses. We do have an emergency list, and they're getting better and better about trying to get in the right number of people, so we can just hit the 10 doses in the bottle at the end. It's really a lot more difficult than you can imagine to try to do that. But I swear to you, we never waste a dose. Not 1 dose is wasted, and we get in, and they've gotten much better at Jim Miller about trying to get the right. It's just hard to count how many people in cars that are getting vaccinated. So, but they're much better about that. We do not waste any vaccine. The other thing is that the disparity between the number that the state is saying that we have and allocated and the number that we it seems like we've given, the reason for that is it's some data issues. So there's a delay in the CDC. There's a gap between the DPH's data and CDC, and they said there's about a week difference between that data. So the CDC's is really not accurate, about a week behind our data. And then the other issue with the state data is the actual putting the vaccines into arms is actually not immediately calculated. That's what we were waiting for, that scheduling system to help us with, because it was going to help us automate that. Right now is a completely manual process. And so it requires that we have people on the back end and the end of the next day to try to put in the vaccines into the state system. So there is a delay in that, getting that information in. So, the state has been very serious about cracking down on folks that are holding vaccines. And so that is not happening on wide scale, to my understanding. And I know that in our county, both the Wellstar Health System is one of our largest providers. We're in most contact with them. I know that they do a really nice job. And we have even people that are really trying to be careful and not schedule anything, and even really begging us to give them vaccines to help. And so we're all kind of in this situation that, there's just not enough vaccine, but we are using what we have, but trying to do it responsibly, because I know that there's some districts that have overscheduled themselves and they may not have enough vaccine. And we really don't want to do that to folks. And so we try to, even though we scheduled 700, once we had 800 plus show up. And so we did however we could, we tried to get as many done as we possibly could. And so we tried to service as many people as we can in that time that we have there.
Okay, another 2 for the price of 1 questions here. Another one we got, can couples register together? And then I think you may have touched on this one already, but I'm a caretaker for my 85-year-old mother. I'd like my teenage daughter and myself to also get the vaccine.
So your spouse, so we do want you to register. You really should register together so we can have enough vaccine on hand to vaccinate folks. So this is one of the kind of bigger issues that we're running into, is a lot of people are bringing extra people, and we just can't do too much of that because we don't have the vaccine on hand, right? So I can't take away other people's appointments because people wanted to show up. And so please, if you and your spouse get the appointments, great. If you want to come together, we'll try our best to do that together, as long as it's not at the end of the day when we're running out of crew. But we can try to accommodate that. Now, but going back to that caregiver, so the teenage daughter, first of all, we do not. We have the Moderna vaccine, so we can't go below 18. And so I want really people to, we need to vaccinate our 65 and older. And so let's please all try to work together. We can't vaccinate your whole household. We really want to try to vaccinate the 65 and older, kind of prioritize them. And then if they have a caregiver that they rely on, then we'll try to do them as well. But we've had people that brought multiple people, and it puts a strain on the system and takes away vaccines for others. So if we could try to limit that to your main caregiver, please let's try to do that right now, because we're trying to stretch this vaccine to get our most vulnerable folks. And so that's what we're trying to do with that.
And Ron, just to reiterate, we do have, if folks are registering and let's say one spouse gets a certain time and the other spouse gets something 3 or 4 hours later, it's fine for them to come together. We appreciate that as long as they both have an appointment. So it's not like they have to come exactly on their appointment and come twice over to the location. We just need them to be registered.
Chairwoman Cupid, I saw you go for the mute button. Do you have something?
I can only imagine how disheartening it is on all sides when you're having people show up who are not scheduled. As much as I'm sure staff wants to be empathetic towards those persons who you're laying your eyes on, imagine those who have waited hours and days to get on the system and how that puts them in an uncomfortable situation. I think it's tough, but we need to be very clear that only persons who are scheduled, unless they have the circumstance where they have a family member scheduled that same day, I think we're gonna cause the system to break down if we are not adhering to vaccinate those who are scheduled. It's just.
Chairwoman, just one more thing. We've noticed a couple of times where folks are making multiple appointments for the same person. And so let's say that I went in and made 4 appointments for Lisa Crossman, and then told my friends that they could go use my appointment. That's not an option. You can't show up. Ross can't show up at Jim Miller Park and say, oh, Lisa Crossman gave me her appointment. It can't work that way.
It can't. And, we really need for citizens we've got to recognize the hardship that is taking you is also taking your neighbors and somebody else's parent and somebody else's family member. And I hate the situation that we're in. I consider my parents, my family members, my neighbors, but we have to respect the system or else it's going to implode, and then we won't have the ability to give anyone an assurance that they'll be vaccinated, even if they schedule a vaccination appointment.
Lisa, I can't believe you heard that I actually tried to pull that. I've got a couple of questions along these lines. This one kind of obviously hits close to home with me. For those who have had COVID and are over 65, should they and can they get a vaccine?
Yeah, so you can get the vaccine. And so the recommendation is kind of the isolation guidelines. And so if you pass that 10 days after your test, so let's say you don't have any symptoms, 10 days after the test, then you should be okay to go ahead and get the vaccine. If you have symptoms, make sure you do the 10 days, but then also I would be well on the way to recovery and just about recovered, just to be sure. So wait out that time as well. Now, if you have received, so if you were sick enough that you received monoclonal antibodies or convalescent plasma during that treatment, you have to wait 90 days before getting the vaccine. So there's a little bit more of a delay on that one.
And we also want to make sure folks know that if they've gotten other vaccines, that they wait, I think Dr. Memark's at least 2 weeks.
2 weeks.
After you've gotten a previous vaccine. So let's say you got a flu shot recently, you need to wait 2 weeks after you got that flu shot to set up your appointment or to seek a COVID vaccination. Or if you have another vaccine, like a shingles vaccine scheduled in a week, you're not going to want to get your COVID vaccination before you go get that shingles shot.
A lot of questions that have come in about the schools. I don't know how much of it we can really get into. But a couple of questions are, have we heard when teachers might get vaccinated is one, and then I'll throw out a follow-up immediately. If I see on the website that there's 5 to 15 cases in a school in Cobb County, should I be concerned?
Okay, so those are good questions. So about the teachers, we don't know exactly. We know they're somewhere in the 1B category. We are hearing some positive kind of news from the governor's office that that he understands the need and priority of having our educators be vaccinated, and so he is taking those under consideration. So we do know that. The school situation is a little bit different situation. So I'll all these websites are real different about how they're presenting the information. So I don't really want to comment on how, to a number, 5 cases or something like that. But I'm also a parent of 2 Cobb County children. And so when I look at them, I look at the situation. So how many cases that we have. And so we know anything over 100 is going to put you at risk. If your children have any comorbid situations, or you got someone in the family that could be potentially put at risk, I think I would really think hard about that, of having that exposure. The other thing is looking at your individual situation. So how many kids are in that class? And so some classes I'm hearing are really thinned out, that only have like 50% of the kids back, and they're pretty far away from each other, and we know they have mandatory masks. Those are really important aspects to this. In other cases, you may have 80–90% of your kids back, and they're grouped together, or they may have some distance. And so, I'll just give you examples for my daughter. She was in a pretty packed class, and people kept getting quarantined, and she has additional responsibilities outside of school that I just couldn't have her quarantined, because I needed her to be able to do that. So we switched her to virtual, because for our family situation, that was easier for us, and I just couldn't let her get sick. My son, I kept him in longer though. So I kept him in longer until the cases, they did get higher, and I got really concerned over the last few weeks, and they did a pretty good job. They're about 4 feet away from each other, but the cases were too high for my comfort at that point. And so, he doesn't do as well on virtual learning, but I made that decision to keep him here. So these are individual decisions, and I encourage you to ask the school questions about these kind of things too, and about how many kids are in your class. And, I look at how many are on the virtual, and then ask my kids how many are in the class. And, you can kind of get a guesstimate that way. And so, but if you have a sufficient concern, if you can keep your children at home during these really high times, I encourage everybody who can do that, because we have a lot of folks who can't. So there are children that need to be in school because of special disabilities, and whose parents have to work, otherwise their families cannot survive. And so I really feel in my heart that we need to have those folks have some security valve for them to be able to do that. But if you can, my situation is suboptimal, but we're able to pull it off. And so, my mom is here and just make sure they're alive, and it works out for us. And so that's the really the best. There's just no black and white on this. It is extremely difficult, and the schools have really tried hard to keep everybody as safe as they can.
All right, I see questions flashing by. Let me give you kind of 2 along the same lines. People are asking, what's in the vaccines? I have allergies and sensitivity. Should I be concerned? And they're also concerned whether we've heard of anybody having adverse reactions.
Yeah, so those are great questions. I'm not going to go into the ingredients list. You can look up their chemical ingredients that are listed. The main things are that there's no latex, preservatives, or eggs in these allergies. They are not live vaccines, okay? They are made of components of the virus that are not live. And what they do is stimulate the immune response to be able to fight against COVID-19. And so the recommendation that we have right now, we have people that come in with some food allergies. If it's nothing too bad, like if you've got 15 allergies, and I might say, okay, you might want to do this under a doctor's supervision. But what we've seen is just, a few allergies that folks have had. What gets my attention is if it's a food allergy or environmental, I'm not as concerned. If you have a serious vaccine allergy, that's what really gets my attention. We have had folks, they actually didn't test it on folks that had severe vaccine allergies. And so that's something that, we probably won't be comfortable doing it in the drive-through or in your car. So that's one thing. When we talk about some of these adverse reactions, it is a very, very safe vaccine, but we have not personally. So we have given almost 8,000, 7,500 doses. We have only had, believe it or not, a lot of anxiety. People are pretty stressed and anxious. And so we're having some very few cases of just some anxiety after the vaccine. Throughout the state, there have been a few, less than a handful of incidents of anaphylaxis, which is a severe allergic reaction that usually will pop up within the first 15 minutes. Now, the good thing is for our seniors is that the older you get, a little bit less chance that you will have of being as reactive and having these kind of reactions. That being said, the recommendation is to be observed afterwards, and we have a medic or a physician on site in the observation area. You go and you park your car, they talk to you for a few minutes, and if you experience anything, you're encouraged to honk the horn, flash your lights, get people's attention. Although they're walking around, you just want to make sure you get their attention. Knock on wood, we have not had anything serious. We've only had just that little bit of anxiety, and man, people have done really great with it. Your vaccine, it takes you about 2 minutes to get your vaccine through us in the car, and you're on your way to sit. And you can sit in your car, even if it's raining outside, the doctor's standing outside in the rain for you.
Yeah, you and I were out at the Jim R. Miller Park last week, and like you mentioned, after you get your vaccine, you pull into a kind of a waiting area. There's a sign there, and somebody initially asks you questions, then you pull into a waiting area. Somebody asks you some more questions. So there's definitely an opportunity to see if anybody's having difficulty. And did you say 15 minutes or so?
15 to 30 minutes. If you there's any concern, we recommend 30. So if you have some allergies or you're worried about something, 30. Otherwise, 15 for most. And you don't have to do it. We've had plenty that just say goodbye and drive away.
Next question is, God bless these people. There's a lot of people that are willing to volunteer their time to help you out. Some have medical backgrounds. What can we do to help out? They're asking. Is there anything they can do?
Yeah, Lisa, you want to take this one?
So yes, we'd love their help. If you go to Serve Georgia at servga.gov, servga, servegeorgia.gov, you can sign up to be a volunteer, and the state will do, that organization will do all of the background information and gather credentials and that sort of thing, and then link you to the county in which you want to serve.
Yeah, I think one of my former colleagues from Kettystone joined me this Saturday and vaccinated with me all day, and so we had a great time doing it.
And we're getting several questions both on social and online about people who are under the age of 65, but in those high risk categories. And where do they fall in all this? When will they be eligible for a vaccine?
So our understanding is they probably are in the next group, depending on which listing that you're looking at. And so there is concern for people with vulnerabilities. I just don't know the exact criteria yet. So the governor, we get recommendations from the CDC, and then the governor decides which one. So he did bump up our 65 and older, and so they are right up there as well as people that have chronic medical conditions or disabilities are on a very high priority list.
And Ross, we'll be happy after this to send you those links that you can put on an FAQ so that people want to check those tiers and the current status of those tiers. They can do that either on the CDC website and on this Georgia Department of Public Health website.
Yeah, going by the questions, there's a lot of confusion about the tiers and who's in them and how that works. So I think that would definitely be helpful. Chairwoman Cupid, I've gone through the top like 20 questions we've had. Do you have any thoughts at this point?
No, I appreciate all of the questions you're asking, and especially to hear the last one about people who want to volunteer to assist. As you know, as much as we are limited by the amount of vaccine, we're also limited by a staffing capacity too. And so any assistance that we can get from those who do qualify is appreciated, and just appreciate the thoughtfulness of those who have asked that question.
And Chairwoman, if you can figure out how to put 30 hours in a day instead of 24, that would help too. So.
Well, that speaks to the heroic efforts of our team, because I know that's what it feels like. And we know we have a lot of frustrated residents. This pandemic has been going on for almost a year, and you have health professionals who are giving it all they have and then some to be responsive to people who are not only suffering, who've been COVID positive, but also to help vaccinate the public. You know, I've heard questions from people like, do people really care? They're putting themselves out on the line and their families are on the line and are doing all that they can because of the commitment that they've made to this profession. And I can tell you, both Dr. Memark and Lisa, for those that have gone through the vaccination experience, we received some rave reviews about just the level of thoughtfulness of your team that's been out there. So I just want to take this time to thank you and to thank your team for having been under, this high pressurized situation for over a year, still coming out every day and treating our residents with dignity and kindness, understanding their vulnerability. It goes a long way to helping everyone get through this, and I thank you.
Thank you.
Yeah.
Really appreciate our team. They have this board out there that says how many days. They're like 200 and something days out there, and snow, hail, everything. And I always like to joke, I know this is a really tough time right now, but once you meet them, you really like them. They're really, they go out of their way to take care of you. And it's a great experience once you get there. And I really hope that we can get everybody out there as soon as we can.
We want to remind everybody too to go visit Cobb and DouglasPublicHealth.com. That's where you can find a lot of the links we've been talking about this evening, and we will continue to provide more information about what's going on. I want to double back just briefly because I'm still getting a lot of questions coming across, and I think we've already talked about this once, but people are really concerned that if they get their first vaccine, it was so hard to get that appointment. How can they be assured they can get that second one? And I know we've already talked about this, but again, that's clearly a big worry for a lot of people. If how can they be assured they can get that follow-up dose?
So Ross, go ahead, Dr. Memark.
Yeah, I just want, this is really important to reiterate. So first of all, it's a minimum of either 28 or 21 days. So please, if you don't get exactly on that day, it's going to be okay. You will not repeat the vaccination process, okay? And so that's what was tested, and that's what they're doing. So right now, it doesn't have to be on that day. So please have a little bit of flexibility with that. And then our people that got with us, the first doses will receive an appointment through email or a call about the second appointment, and it will be through Jim Miller. If you look on the back of your card, I was just looking at my card, and so if you have it, if you look on the back of it, you're going to have that date on there, right? So on the date on the back, and it's going to say where you got vaccinated as well. So on the front, it says where we were vaccinated, and on the back, it says the date. So that's around the date that you will get that appointment. If for some reason you fall through the cracks, and I very much doubt that, if that happens, you can let us know, and we will get you in as long as it's a Cobb and Douglas Public Health vaccine, and it's around that day. You can't come before. The state has prohibited us from giving any doses before that date to try to make sure we stretch out these vaccines. And the other thing is, that we mentioned this morning, but I'll mention here that we are prioritizing second doses right now, okay? And so as our allocations and our staffing allow, we will prioritize second doses over first doses. We have to really make sure that our vaccine supply and the supply chain are intact. And so I'm not going to keep creating a problem if we don't have vaccines. So we will make sure we do this second dose is a priority. If we have to slow down the first dose, we will do that. And then we can create more appointments at our Douglas location, or we can try to help our partners get more vaccines throughout the community. We can request them to get more vaccines. So I just want to please, everybody just relax a little bit. We will get you that second dose. It does not have to be exactly around that time, okay? We will get it for you, but please don't panic about that.
And we also mentioned too that if you get Moderna for one, you need to get Moderna for two, Pfizer for one, Pfizer for two. Somebody asked here, what happens if I get them mixed up? I don't know if we have an answer to that question.
Now, bring your card and make sure that it is checked. There's a little sticker on there, or the information is on there. The person will confirm it with you, but you should also confirm too that having that extra layer of checking is always good. And then also we have other providers. So if somebody opens up a large site, man, go ahead and do it. If it's convenient, get those vaccines any way you can. So,
Dr. Memark, were persons that were vaccinated instructed to hold on to that card?
yes, if you did sign up for Be Safe like I did, you'll get a reminder too through there about your vaccine.
Okay, thank you.
Yes,
Do we have a timeline for the next phase? People have been asking about that.
No, no timeline.
And one thing before I toss it back to Chairwoman Cupid, who can also comment on this as well. I mean, when you look at the timeline of questions that we've been receiving on our platforms during this thing, you understand that there's just a lot of extremely frustrated people who really want to get vaccinated, like they're being advised to, but are having trouble getting an appointment. Just some thoughts to those people about why they're having the difficulty, what's leading up to it, and what they should do next.
So we definitely have more demand than we have supply. That is just the math of it, unfortunately. The federal government has not been able to get us more vaccines. And so when you do the math, we receive about 80,000 doses that go to all of the state. So everyone in the state. When we're able to do how many, 5,000, about 5,000 a week, if you think about it, that's just us. That's a pretty good amount that we're getting compared to the amount that's being that is available. And so we have over 1,700 providers that are authorized, but I can tell you 1,700 providers do not have vaccine. Now, when we get to that point, like the flu shot, where everybody's able to give out those vaccines, we will be in a much, much better place. But right now, it is a simple supply versus a demand issue. We just need more supply from the federal government, and we just aren't getting it right now. And so I know that it's right now is kind of a crunch, and I'm sure in the next few weeks we'll hear more about how much vaccine will be coming down throughout the country.
And Ross, I would just add, it seems like it's getting better, right? From the beginning, when we first were getting vaccine, it was in really, really limited quantities. And so it does seem like it's improving. It's just not improving as fast as we want it, or as fast as residents want it. But so I would say, do your best to be patient with all providers, not just with public health, but we're seeing this across all providers in the community. And so just be patient, know that folks are working at their maximum capacity. We are not sitting on it. We don't want to sit on it. We want to get these shots in arms. It's kind of our mission in life right now to get these shots in arms. And so if you'll just have a bit of patience, it seems like things are starting to ramp up, but they're just not there yet.
And Lisa Crossman, I think you talked about this already once, but there's been several questions on here that people know people who may need help. They're not family members, but they want to help these people get into the system and get vaccinated. How can they help them? What should they do?
So a couple things. First of all, let me also say on that last question, that be aware that you also don't have to get vaccinated in your home county. The goal is, this is a Georgian campaign, right? That we want to vaccinate Georgians. And so they may look and see if they're on county lines from where they live. They might find that it's more convenient to get vaccinated in a neighboring county, and that's completely okay. So to answer your question, your current question about how do I help family members, again, I go back to how I always helped my parents when they needed to make medical appointments. I might make the call, I might get on the website at their doctor's office to schedule that appointment. And so that's certainly some way that a family member can help them. And then also be available to help transport them out to wherever they have the appointment.
Yeah, and that goes for even if you're not a family member of someone, you can still do that, correct? Yeah. Okay, Chairwoman Cupid, I've hit the highlights. More are still flashing by, but I'll turn it over to you for some comments.
Chairwoman, one more comment. Ross, you just made a really important note that I want to highlight. You know, when people register a family member or a neighbor for a vaccine, they don't have to put in really a lot of identifying information. We're not asking for Social Security number. We're not asking for driver's license number or birth date. So there should be, it should be okay for a friend to help you register. It's really just the name and an address and a phone number contact for that. So I just want to highlight that. No one should be asking you, no one should be offering to help you register and then asking for your Social Security number or asking for a driver's license or something, or asking for any money in order to register you for an appointment. So if anybody does offer that ought to be a red flag to you.
Those are really good points that Lisa's making. We did see that happen in the beginning of the pandemic. And so remember when the testing was a little bit scarce at first, and this is such a high demand. Please watch out for scams out there. This is a ripe area to see people get scammed. So please be careful.
All right, Chairwoman Cupid, that's the majority of the questions that we've got coming through. I know we're past an hour now, so I'll turn it over to you for some final comments and see if Dr. Memark or Lisa have anything else to say as well.
Thank you, Ross, and thank you to all of you who tuned in here today to get answers about where we are with this pandemic and particularly with our vaccination response. I think Dr. Memark summarized it well in saying that this is an issue of supply and demand, that we are only able to vaccinate our residents to the number of vaccines that we receive, and we are limited by the number of vaccines that we receive from the federal government. But as Lisa Crossman shared, they are doing their best to make sure that they get the vaccines out as soon as they get them. And so we encourage you to please be persistent in trying to get scheduled, but just be understanding of their limitations. It was provided that the state has received about 80,000 vaccines to go across 159 counties, with Cobb County receiving about 5,000 per week. Cobb County probably has about 80,000 residents who are over the age of 65. So this puts things in perspective. We know we have a number of people who have been trying to sign up online and have experienced system issues. Recognize that our Cobb County public health staff, as well as other local governments, thought that this would have been on a statewide system and found out within a week or two that they'd have to provide this service locally. And so they had to use the capacity of which they were given, but they're expecting for things to move to another server, and hopefully that will help to relieve some of the issues they've had with their current servers. But be mindful of that issue just on top of the sheer issue of supply. In the meanwhile, we're still in a pandemic. We have very high rates of COVID, where high was considered 100 out of 100,000. We are at 1,100,000 cases out of 100,000 people. Please, in the meanwhile, while you're waiting to be vaccinated, please continue to stick by those 3 W's, where you watch your distance, you wash your hands, you wear your mask. we've been advised to even shelter in place to the best extent that we can because of the rates of spread. Be mindful that we can still do something to help limit our loved ones from getting the virus. I want to thank all of you who are working in our healthcare industry. I want to thank the staff that's available today, Dr. Memark, Lisa, our IS team for helping to provide this and for doing what you can to help educate the public on where we are. We hope to continue to update you as we get any changes, but if you want to be updated on where you can find options for vaccination, please visit that Georgia Department of Public Health site. It's my understanding they update that real time to let you know which providers have vaccine. And you don't necessarily need to get it in Cobb. You can cross county lines if needed. As was shared, this is a statewide effort. So again, thank you. I appreciate your time. I appreciate these great questions. And we look forward to keeping Cobb County as healthy and safe as possible as we get this vaccine out, and particularly to those who are most vulnerable in our county. Thank you.
Thank you.